We're here with Cameron's mom. Cameron's been under treatment in this office for about 5 months. Can you tell us what brought Cameron into the office?
Well, he was having problems at school with focusing, following directions, and using self-control. He was not befriending the other children as we thought he should, and the teachers were very concerned about his behavior because it didn't seem to be that he was being defiant or rebellious. It was just he was not under control.
And so you never did medicate him, did you?
No.
And that's one thing you wanted to avoid, I would think, would be to medicate the child.
Right. We did not want to medicate him.
Now, he was having some academic issues too, wasn't he?
Well, he is very, very smart. In fact, he is quite gifted, but he was not finishing his work. He would have a worksheet to do, and he would be very unfocused and distracted and be unable to complete even a simple worksheet.
So you were concerned as a parent naturally and didn't want to medicate the child. So I think it was your mother-in-law that suggested maybe that you bring him here to be evaluated.
Yes.
And then of course we did an evaluation. And what did you think about the evaluation? What did you learn from that?
From the evaluation, especially from the book, the Disconnected Kids book, we found many symptoms that Cameron had that did put him in this category of FDS, and we knew right away that this was definitely something that we wanted to pursue.
Okay, so then we started treatment, which consisted of some neurological interventions as well as some dietary changes. Explain briefly what kind of dietary changes that we made with Cameron.
We put Cameron on a strict gluten-free, dairy-free diet, and our whole family went on the diet. And within 1 week, I would say I noticed a big difference in his ability to make eye contact, listen and follow directions, and focus.
Okay, good. And so you were doing some things at home as well. There were certain exercises and so forth that you performed with him during the course of this. And of course, we didn't use any medications or anything else other than the neurological treatments in the office, as well as the exercises you were doing. So now, after 5 months that you've been coming here, what kind of changes are you seeing today?
Social changes have been great. He has friends. He plays with other kids when we go to playgrounds or play areas or parks. I've also noticed that he pays attention to the people around him. He knows people's names now. He can tell you anything about the people around him. That's a big change. I've also noticed that he makes eye contact, he listens much better, and he's able to carry out tasks fairly easily. Much improved.
I think you mentioned he started back to school this week, and his teacher had made comments about she saw a difference or a change in Cameron.
Yes, she was his teacher last year for a portion of the year, and he was having all of the difficulties I mentioned earlier. And this week, after only a few days of school, she said that she has seen a big improvement. He's not doing the little things that were bothering the class, such as humming to himself, falling out of his chair, just not being as self-controlled. He is much more self-controlled.
Well, cool. So would you recommend folks that may be having these types of issues with some of their children, concerning if they've been diagnosed with ADD, ADHD, or some of these other issues, that they might benefit by getting the child checked out?
Yes, as a parent, and I'm also a teacher, so from both of those aspects, I definitely recommend it.
Well, we certainly appreciate your time with doing this, and we've certainly enjoyed working with Cameron. Thank you.
Thank you.